There are so many non-pharmaceutical based interventions that we can be providing for patients, particularly from the symptom management perspective. So we know that, for example, for fatigue management, fatigue is one of the most highly reported symptoms that lung cancer patients have, but all patients have. We know that actually, like all the evidence shows, first line gold standard treatment for them should be physical activity and CBT-based behaviour change interventions. So we know the evidence is there for fatigue management, and that should involve physiotherapists, occupational therapists, psychologists if required, dietetics if we need to optimise their nutritional input. From exercise and returning to function, we know there's huge roles for exercise in improving cardiopulmonary fitness, improving muscle strength, reducing the risk of malnutrition, cachexia, improving quality of life, improving cognition. We know for cognitive changes, and there's a significant amount of patients who have cognitive changes just related to having lung cancer, plus treatments like chemo, but also there's, I think, 30 to 60% of people who have PCI. If they've got small cell, they're going to have ongoing cognitive changes. So we know that you want to be doing early referral into OTs or neuropsychologists to be doing interventions. We know from a nutritional perspective, there's a huge role for dietetics, early intervention and screening throughout to reduce malnutrition and risks of cachexia and sarcopenia, because they're going to allow us to actually optimise outcomes for patients. Sleep deficits, psychology is really helpful for that. And we also know from a psychological perspective, over 50% of all lung cancer patients have depression, and they have some of the highest levels of psychological burden. And so early intervention really from a psychologist is so key to help actually allow people to get back to what they're doing, reduce the risk of suicide, and just improve overall quality of life. So that would be just a snapshot. There's so much more we can be doing.